Good morning, everyone. My name is Kelly Nye-Lengerman, and I'm joining you today virtually. And as we share with each other from around the country, I'm very pleased to be here. So let me be the second person to welcome you to the National Training Institute. I want to also first take a moment to thank the team at the Center for START Services for their strong pivot to create a virtual event for us this year. It really required commitment not only from the START Services team, but as well as many of our partners, the IOD, and you as attendees today to have flexibility and patience as we move to this new model. That said, even though we find ourselves today in this virtual environment, it doesn't decrease our ability to connect, to network, to share, and to grow in both our knowledge and experiences. So again, thank you and welcome. I've had the chance to get to know some of the members of the START Services leadership team at IOD. And when we were chatting last week, they gave me the opportunity to sort of share a few thoughts or observations about the START Services model and how START works within the Institute on Disability. And so I wanted to take just a few moments to sort of share some general thoughts or observations. And some of these may not be anything new to you at all because they're things that you live and breathe and work with each day. But I think as a new person sort of stepping in of what does START represent, what does START put forward to show the community, to show our states, to show our partners, and to show individuals and families, I want to share some of those with you. So as a new employee and an incoming director, I have a lot to learn. I'm really motivated and I'm really excited, and I share some deep sort of professional and personal connections with the values of START as well. As Linda mentioned, I am coming from the University of Minnesota and do have a balanced work experience portfolio, both in service and in policy and research. But what I've certainly come to find over the years is that we all have so many teachers, whether they're from our colleagues within states, whether they're from policymakers or other professionals. And some of our greatest teachers can be those individuals who are living with disabilities, their families, and their support circles. And so as I step back and look into this model of START, I'm sort of struck by some really key values, some of which are shared with social work when I think about things related to justice, equality, and service. And so in a number of those ways, I think it puts START in a unique and strong position to provide services and supports around the country. First and foremost, that the START model is a strengths-based model that really draws upon individuals' gifts, talents, and contributions as individuals, and that the model in and of itself really embraces person-centered practices with a strong focus on balancing what is important to a person with what is important for a person. I also see that the START model in and of itself really has a strong foundation in justice in the sense that collaboratively and collectively, we're working to address disparities both in experiences and outcomes for individuals who are living with intellectual disability and a mental health condition, while at the same time promoting dignity for those individuals and their families across the lifespan, focusing on the importance of community inclusion and participation. Another observation I'd like to share is that as a researcher, there are many different models of services and supports that we find in our field and industry, but core to the START model in and of itself is this collaborative design that really requires and has a space for all of the support circle, with the individual of themselves being at the center of that, and that is incredibly powerful. The START model in and of itself also is data informed, meaning that we use the data and information and evaluation materials that we collect to inform and improve our practices and strategies. And that the START model is strong in implementation with fidelity, meaning that if you are in a START program in the state of New York versus the state of New Hampshire or any place in between, is that this model is one that, while there is nuance, it's implemented consistently over time, and that really allows us to be able to have a strong understanding of both the outcomes and impact that START services provide. I think the other component that I certainly notice and is definitely not lost, but is this other narrative around positive messaging when you look at both the research and data that comes out of the Center for START Services and comes from all of you. And the fact that when an individual is supported through this model, there can be a reduction in service costs, there can be a reduction in emergency room placements and hospitalizations. And those are really powerful messages, not only for individuals and states and communities, but they're also very critical messages for our policymakers. But I would also want to point out that really at the core of the model in and of itself, it's about improving the quality of life for individuals who live with intellectual disability and mental health conditions. And again, those outcomes and experiences that pertain to health, that pertain to the appropriate and balanced supports, as well as those outcomes that really are focused on increasing belonging and participation for people to have meaningful lives determined and decided by themselves. I also would like to share an important observation about sort of the Center for START services in and of itself, and really its robust approach to providing not only a model of services and supports, but also a strong component around research and evaluation. Again, that data and that information that allows us to further refine and enhance the services and the model that we provide. But at the same time, also providing robust professional development across a variety of topic areas related to intellectual and developmental disabilities, mental health, and community supports. And so again, this multifaceted approach really is incredibly unique and incredibly strong. And so again, as a new person coming to join the IOD, which I'm thrilled about, I'm so very excited and pleased to be working with the Center for START Services and with all of you, and kicking off sort of my participation and joining today at the SNTI event, as I've learned that it's lovingly referred to. I want to wish you a very happy and wonderful event today. I hope that the speakers that you see, the panels that you hear, and the posters really help you find some inspiration, some goodwill, but at the same time that today and the events over the course of the next 3 days also really stimulate your curiosity and do continue to create that strong sense of urgency for the work that we really the work that lies ahead of all of us in the weeks, the months, and years to come. As a model like START, now more than ever, is important and relevant to all of the work that we do. So thank you for being a part of today's event, and thank you for being a part of the Center for START Services. I hope in the very near future that I'll have the opportunity to meet you in person at a future event. Enjoy the rest of your conference.